Good evening and welcome. Tonight's discussion is going to be about the dangers of smoking and why you need to stop. My name is Virginia Borders and I am a nurse, and I'm going to talk to you tonight about the dangers of smoking. Before we begin, I want to ask you a question. If you could stop the spread of lung cancer and you could eliminate it from society, would you do that? I think the answer is yes. I think we all feel that we would. Well, according to the American Cancer Society, we can do that because it is the most preventable cancer that we know about today. The second question I want to ask you is, would you ingest willingly a bag of charcoal? Or would you willingly ingest a bottle of insect repellent? I think not, because we know that these are poisons. According to the American Cancer Society, we know that there are 4,000 different chemicals that are associated with tobacco and tobacco smoke, and over 60 of those are known carcinogenics. So with that kind of knowledge, why in the world would you want to continue smoking? And because every time you begin to smoke, you ingest the same kind of toxins and poisons that I showed you just previously. Let's move on and let's talk about what actually happens to your body when you smoke. If you look at the poster here, you'll see that there is a body of a human, and we have several things on here that are associated with smoking. Let's begin with the mouth. If you smoke, you're at a high risk for having problems with the lips, with the tongue, with the throat, with the stomach. If you look carefully here, you'll see that there's an ulcer in the stomach, and also with the bladder. Cancers can form anywhere from the opening of the lips all the way through this system. The reason that the bladder is such an issue, is such a target site for cancers, is that when you breathe in, when you take in these toxins by the use of tobacco, it has to be excreted, and you will either excrete it through breathing or mainly through the bladder. So this is why this is an important site for cancer. The other thing that we want to talk about is what happens to the lungs if you don't get a cancer. Many people develop what's called bronchitis, chronic bronchitis. Many times this will turn into emphysema, which is a more chronic state. And then these two together are known as congestive obstructive pulmonary disease, which is also a very severe respiratory problem. Also, when we look at the anatomy of the lungs and the heart, if you look at the poster, you can see that on this side you have a smoker's lung, and on this side a healthy lung. The lungs and the heart work together, so whatever affects one usually affects the other. One of the problems that occurs with smokers is what's called arteriosclerosis, or commonly called hardening of the arteries. If you look here, you'll see there is a plaque inside this artery. If this plaque breaks loose, it can travel to the brain and cause what's known as a stroke. This is an irreparable problem, and damage is done, usually leaving the person with some type of paralysis. I want to move on here and talk about signs and symptoms that commonly occur, and if you have one of these, you might want to see your healthcare provider. In the mouth, you may have white patches on the tongue or sores within the mouth or lips that do not heal. You may have systemic problems where you're beginning to feel extreme fatigue, or you're having wheezing or coughing, and maybe sometimes even coughing up blood. If any of these things occur, you need to see your physician. The last thing I want to leave with you is the thought that the American Cancer Society, the American Lung Association, the American Heart Association, and the National Cancer Institute have done lots and lots of research on this subject, and it is conclusive that this is a very bad thing for you. Now, I want to leave you with this one thought. You need to stop smoking, and if you do and you have problems, you can contact one of these agencies and they'll be glad to give you assistance. If you smoke, there's a better way. Remember my words and quit today. Thank you.